Hello, everyone. My name is Sazin Sadif, and today I'll be presenting on disparities in mental health care. Today's date is 18 June 2025. So before we delve into our presentation, this is a very basic introduction of me. I am a senior at Rajaputra Model College, Dhaka, Bangladesh. I am an independent researcher at the Department of Educational and Counseling Psychology at University of Dhaka. I am the vice president of Raju College Language and Recitation Club. Also, I write contents on mental health in Mercury.world. So what is mental health disparity? According to the National Institute of Mental Health, a mental health disparity is a significant difference in the rate of mental illness, prevalence, morbidity, mortality, or access to treatment between specific populations and the general population. In simpler terms, some groups struggle more with mental health than others. Some may become ill often, develop more severe conditions, or be unable to receive the care that they need. The global picture of mental health disorders. 1 out of 8 people globally have a mental health condition, and according to the World Health Organization, in low and middle income countries, more than 75% of people with mental disorders get no treatment at all. The global burden of mental illness. A median of 40% people are diagnosed with depression did not receive care, and 29% people with psychosis received care. That means 71% people with psychosis are untreated. COVID-19 had a profound impact on mental health disorders. In 2019, it was 970 million people who had a mental health disorder, mostly anxiety or depression. And we can see that in 2020, due to the COVID-19 pandemic, the of anxiety and depression related mental health patients, it further spiked 25%. Let's compare between high-income countries, middle-income countries, and low-income countries' mental health care. This study was done by Laura and others in 2020. We will be discussing the three major categories, which is population per outpatient facility, spending per capita, and psychiatrists per 100,000 people. So in the first category, we can see that in high-income countries, the population per outpatient facility is nearly 50,000 people. And in the low-income countries, it's over 2 million people. The spending per capita, it was 29.2 US dollars, and in the low-income countries, it is 0.01, which is not even a dollar, which is spent on mental health care. And in psychiatrists, per 100,000 people, we can see that the high-income countries have approximately 6 psychiatrists per 100,000 people, and in the low-income countries, they do not even have 1 psychiatrist per 100,000 people. And we can see that the low middle-income countries do not also have 1 psychiatrist per 100,000 people, whereas the upper middle-income countries have nearly 4 psychiatrists per 100,000 people. The key causes of mental health disparities. Socioeconomic inequality. Because the mental health disparity is so much prevalent, lack of public funding and insurance in low and middle income countries, they do not seek care that they need because of their socioeconomic status. Even in the wealthy nations, low-income groups face barriers to care, mental health care. Healthcare infrastructure. In the higher income countries, 9 mental health professionals per 100,000 people is present. And if we look at a low-income country like Bangladesh, it is 0.34 professionals per 100,000 people, roughly 270 psychiatrists for 165 million people. Stigma and cultural attitudes. In South Asia, mental illness is often linked to supernatural forces. Families frequently consult traditional healers like shamans before medical professionals. A 2023 WHO survey found widespread stigma across both rural and urban areas in Bangladesh. Policy and financing. 39% of countries allocate promised mental health funds, while 61% fail to do so. Even where policies exist, implementation is weak. In Liberia, in 2019, they adopted a mental health policy, but they failed to enforce it. And in Bangladesh, in 2009, Bangladesh introduced a mental health policy, yet significant gaps remain. So let's talk about mental health disparities in Bangladesh. Bangladesh is a small country in the South Asia, and it has 175 million people as population. We can see that 18.7% of adults and 12.6% children have a mental health disorder, and 92.3% of adults receive no treatment at all. Due to stigma and lack of services, the treatment gap has been surveyed 96%. That means less than 4% are treated, and only 0.08 US dollars per capita, which is the 0.05% of health budget goes to mental health, and less than 0.11% of the population can access free psychotropic meds as they need. 97% of spending on mental health hospitals goes to two Dhaka institutions. Dhaka is the capital of Bangladesh, and so what about the other regions of Bangladesh, like Khulna, like Sylhet, like Rangpur, and Chattogram? Roughly 0.34 psychiatrists and 0.43 mental health nurses per 100,000 people is surveyed in World Health Organization's survey. The main cause of mental health disparities in Bangladesh is lack of awareness. They think that mental health illness is a supernatural activity. And they feel shameful about mental health illnesses because they think it is something done by supernatural forces like jinn, bhoot, and that sort of things. The social taboo. People think that the mental health illness is often related to someone who has no shame, and that's why their parents try to hide, and people tend to hide their mental health illness. That leads to suicide and other outcomes. They consult traditional healers who do not have any idea about mental health illnesses, and they often diagnose them as supernatural forces and guilt. They think this is full of guilt. That mental health illness is a shameful activity, and they do not reach out to mental health professionals because of guilt. A personal loss in 2022, I lost one of my closest friends from Madaripur to suicide. You can see that Madaripur, which is like on this map, is not so far than the center of Bangladesh, which is in Dhaka, and she did not even receive care, even though it was near from Dhaka. So, what are the pathways to equity, and what we can do to remove the mental health disparities? Raising awareness from every angle through schools, families, media, and cultural platforms to fight stigma and normalize mental health. We should build accessible care systems, invest in community-based services, and train local health workers, not just specialists. We should advocate for policy change, push for mental health to be a part of universal health coverage and protected by law. And we should also advocate for the policy to be implemented, not just applied in Bangladesh system or in the other countries' system, but also they should implement that to help actually make a change. We should mobilize youth and global solidarity, empower young leaders, cross-border collaboration, and digital innovation to close the care gap. These are the references, acknowledgements, my family who have been supporting me throughout the process. Mindwell Lab at University of Dhaka, thanks to them for giving me the opportunity to do research in the lab. Mercury.world, where I write about mental health disorders. Global Health Leaders Conference at Johns Hopkins University. Dear audience who are striving to make difference through policy change and being aware of mental health and other global health fields. Thank you so much for watching. Feel free to reach out to sadif@gmail.com if you want to mail, or you can connect me in LinkedIn. This is the link.